Welcome back to Body Beautiful. We're talking about safety in cosmetic surgery with Dr. Elizabeth Lee. First, let me remind you that we'll be taking your calls with any questions you have. Here's the phone number, 800-440-4884. We'll also be posting the number for Dr. Lee's office during and at the end of the segment. And remember, any advice we give you today, you want to consult your own physician as well. Although a lot of our callers seem to want to
consult me.
Yeah, consult you, which you were saying off camera that, well, the work is already done. It's kind of tough to come back in, but...
And again, you know, this is patient safety issues. You know, anybody who has surgery should be comfortable enough with their physician to ask the questions afterwards or before the surgery when they have a problem.
Do you ever have to clean up botch jobs?
I hate that term, but yeah, I do see patients who have been unhappy with their surgery, and I'm sure I have patients out there who are unhappy with my surgery. It all goes around, but yeah, there are times that I see patients where I'm really concerned about what's been done to them.
We were talking about how important it is to make sure that your physician, whoever you choose, is board certified.
Right.
Got a call from Melvina in Oakland. You've got a related question. Good morning, Melvina.
Good morning.
Good morning.
So what's your question for Dr. Lee?
I would like to know, where can you look to find a doctor who's certified?
What you want to do is go to the either ASAPS or the American Society for Aesthetic Plastic Surgeons, or the American Board of Plastic Surgery, ABPS website, and I believe we're going to be posting those on my show. I also have links to them on my website, artfulsurgery.com, and you can look at your physician's board certification on either of those sites.
Okay, Melvina, hopefully that answered your question. We're coming on the heels of Halloween. And there's some scary masks out there, and anybody that has seen some of the people there who seem to have, I don't know what you call it, plastic surgery addictions, it can get pretty frightening. Michael Jackson, certainly, through his autopsy, they revealed
and
that
he had surgery. He did.
Mickey Rourke doesn't resemble anything.
Doesn't look at all like himself.
Yeah, and it's not just the boxing.
Right. No, boxing generally breaks the nose, and there's a particular look for that.
And then we have people like the Catwoman, and we're not showing pictures of the good, bad, and the ugly because you know, it's not really pretty to look at. But $4 million worth of plastic surgery. I can't even think of how many procedures.
And she looks really peculiar. Yeah. And I don't know what she's thinking. I don't know what her plastic surgeons are thinking if when they're willing to do this. But you know, we live in a society in which you know, cosmetic surgery is something that is a moneymaker, and it is possible to go out there and find people who will do things that will make you look odd if that's what you're asking for.
Now, but you look at celebrities, that they have the money. You'd think that they could get the best of the best.
You would think, and the only thing I can say is that it's very hard to say no to a patient who is asking for your help, and I would assume that if I have difficulty saying no and saying that what a patient's asking for is probably not going to make them look normal, I would guess that in LA it's even harder because celebrities are just used to never hearing no. From what I understand, I'm not a celebrity, and I don't play one on TV, yeah. So
it sounds like you have no problem saying no if you need to say no.
I do say no, but it's not easy.
Do you think there are other issues, underlying issues, psychological, emotional?
Well,
I mean,
of course,
you can't fix those with plastic
and it's important, at least in a consultation in my office, I spend a fair amount of time trying to understand what the patient's goals are. And there are definitely times where I meet people who, you know, want something fixed, and I'm just pretty sure that doing cosmetic surgery is not going to fix the underlying issue, that it has nothing to do with their nose. It has to do with a whole bunch of other things.
Now, what about medical tourism? And what I'm saying is, if you don't get the right answers here in this country, then some people will go outside the country.
And I'm not so sure that it's even an issue of getting the right answers here. I think it has something to do with money. I think that people are excited by being able to go to other countries and get a procedure done for a whole lot less. And there's another website I'd like to recommend, which is called realself.com. It's a website where patients can write questions and board-certified physicians answer them. And I just answered that question on Real Self because somebody asked, is 10 days enough recovery time for surgery abroad on my breasts and tummy? And the answer is absolutely not. If I have a patient who wants to come from New York to have surgery with me out in California, I will tell them that they need to be in town here for at least 3 weeks, and that they have to be prepared to come and see me on a monthly basis for about 6 months after that. And they have to have a plastic surgeon in their hometown who is willing to see them if there's an emergency
Yeah, what
in
if
that
something
time.
goes south? What if something, you know,
Well, then you're in the position of being taken care of by somebody who hasn't done the surgery, and that's a very scary position to be in. Or to be in a foreign country where you don't speak the language and you end up in one of their hospitals. It's really frightening.
Let's put up the website because we want people to be able to see all this. We've given them a lot of links and all that. So let's go ahead and put that up. For more information about Dr. Elizabeth Lee, you can go to our website at artfulsurgery.com. When we come back, we're going to continue our chat and take your calls.
Good.